Hello and welcome to this afternoon's risk management session with the Scottish Sports Association and Gallagher. Really delighted to have such a broad range of our members and partners on the call today. Thanks very much for joining. We know this is a particularly busy time for everybody at the moment. Risk management is literally king at the moment, as I'm sure it is at all times, but certainly at the moment as well. We're delighted to bring this opportunity together, which focuses on risk management as we see in the sporting environment right now. So this is a specialist session on risk management for sport as we all work towards exit planning and exercise extension from COVID. So particularly pertinent session today. Just to let you all know, we are recording this session today. The Scottish Sports Association will then share this with governing bodies, and we ask that you then feel free to share this with your clubs, trying to share that breadth of information about risk management to make sure that we're all operating as efficiently as we can and all playing our part in exiting from COVID. This session will follow with a question and answer session, so again, feel free to have any questions in mind from there, and we will try and make those available as a separate resource so people can access those. And at the end of this presentation, there will be links to quite a number of the resources that are referred to throughout the session, so we'll pick those up at the end. The Scottish Sports Association is delighted to be working in partnership with Gallagher. Gallagher are our preferred insurance partner and are one of the world's largest insurance companies in the world, and very much specialise in risk management as part of that. So delighted that they've really kindly helped us with the session today, and I know Bryan is an absolute expert in risk management. Delighted to hand over to Bryan, and I look forward to speaking to you all after that.
Welcome to the risk management presentation, COVID-19 through and out of the crisis and return to sport. Following an introduction, I'll set the scene by briefly defining COVID-19. Important to understand the subsequent topics covered, which will consider responsibilities, risk assessments, and the burning issue returning to sport. Beyond guidance, please use the chat facility to raise questions while they remain fresh in your mind. We'll respond to these either at the time or during the question and answer session after the presentation. Notwithstanding the plethora of advice and guidance relating to COVID-19 lockdown and gradual easing of restrictions, there is uncertainty about what we can or cannot do, questions about interpretation of guidance, and concern about sport as we remember and will it be able to return when easing of current restrictions permit. I'm confident I can advise you on these 3 points. Before we start, a little background with regards to myself. I'm an associate of the Chartered Insurance Institute, a Chartered Insurance Risk Manager, a member of the International Institute of Risk and Safety Management, and a technician member of IOSH. I have over 40 years' experience in risk management and specific knowledge of sports national governing bodies through auditing of their health and safety management systems and procedures. So what is COVID-19 and how is it generally controlled? Coronavirus, COVID-19, is an infectious disease caused by severe acute respiratory syndrome, coronavirus 2, SARS-CoV-2. The main symptoms are a high temperature, a new continuous cough, and/or a loss or change to sense of smell or taste. Transmission is through respiratory droplets from coughing, sneezing, and contact with contaminated surfaces. The predominant modes of transmission are assumed to be droplet and contact. The following acronym, FACTS, is a particularly useful reminder for what we should be doing and how we should be controlling. Face coverings, wear them. Avoid crowded places. Clean hands and surfaces regularly. Ensure the 2-meter social distancing and self-isolate. Book a test if you have symptoms. There have been many questions raised regarding the use of personal protective equipment to control COVID-19. PPE is considered to be the last resort, the last control in the hierarchy, the belt and braces after the piece of string. The World Health Organization has stated that for all the most effective preventative measures against COVID-19 include maintaining physical distance, a minimum of 1 meter, clearly it's 2 meters in the UK and Scotland, performing hand hygiene frequently with an alcohol-based hand rub if available, and if your hands are not visibly dirty, or with soap and water if hands are dirty. Avoiding touching your eyes, nose and mouth. Practicing respiratory hygiene by coughing or sneezing into a bent elbow or tissue, and then immediately disposing of the tissue. Wearing a medical mask if you have respiratory symptoms and performing hand hygiene after disposing of the mask. Routine cleaning and disinfection of environmental and other frequently touched surfaces. The hierarchy of control does put it at the bottom, well, almost at the bottom. The discipline aspect is really ensuring that the controls that are in place are monitored and reviewed and enforced. So personal protective equipment. Essentially, the government guidance is that if you're already using PPE in your work activity to protect against non-COVID-19 risks, you should continue to do so. But when managing the risk of COVID-19, additional PPE beyond what you usually wear is not beneficial. This is because COVID-19 is a different type of risk to the risks normally faced in the workplace and needs to be managed through social distancing, hygiene, and fixed teams or partnering, not through the use of PPE. The exception is medical and healthcare settings such as hospitals, dentists, care homes, and first responders, and we'll come on to first aid later. Unless the situation is one where the risk of COVID-19 transmission is very high, the risk assessment should reflect the fact that the role of PPE in providing additional protection is extremely limited. PPE when administering first aid is an exception, and I'll cover this later. There are some circumstances when wearing a face covering may be marginally beneficial as a precautionary measure. The evidence suggests that wearing a face covering does not protect you, but may protect others if you are infected but have not developed symptoms. So who is responsible and why? Well, responsibility is spread throughout the organisation. We're all responsible, but some are more responsible than others, to misquote a proclamation by the pigs in George Orwell's Animal Farm. So who has responsibility and what is meant by everyone? Well, there's a list: directors, employers, self-employed, persons with control over premises, access and egress, plant, equipment and substances, tenants, employees, volunteers. Health and safety law does not impose duties on volunteers, but it does ensure their protection. Duties are, however, imposed by civil law, club officials, club members and officials. Responsibilities are imposed morally and by the law. Morally, humans have an inbuilt instinct for self-preservation and protection of the species. Generally, we don't generally want to inflict harm on our fellow man, woman or child, but there are exceptions. Sometimes on the sports pitch, field or ring in the heat of the moment, but all quite convivial in the bar afterwards. In civil law, there is a general duty of care, also known as the neighbour principle, which requires individuals to take care in their own acts or omissions so as not to cause harm to others proximate to them, or in other words, their neighbours. Criminal law imposes responsibilities and duties detailed in various statutes. All health and safety legislation in place prior to COVID-19 applies unless modified by the coronavirus COVID-19 specific legislation. Specific reference should be made to the duties imposed by the following legislation, of which you should all be familiar. Sections 2, 3, 4, 7 and 8 of the Health and Safety at Work, etc. Act 1974, for example. The Management of Health and Safety at Work Regulations 1999, as amended. The Personal Protective Equipment at Work Regulations 2002. The Control of Substances Hazardous to Health Regulations and the Reporting of Injuries, Diseases and Dangerous Occurrence Regulations 2013. More on this later. COVID-specific legislation includes the Coronavirus Scotland Act 2020, intended to provide relief during the coronavirus outbreak and the disruption caused by the outbreak, and the Health Protection (coronavirus) restrictions (close brackets, open brackets, Scotland and close brackets regulations 2020), a world record attempt at the number of brackets that can be inserted into a title of a piece of legislation, which businesses are to close. So the Reporting of Injuries, Diseases and Dangerous Occurrence Regulations 2013, under which COVID-19 is a hazardous substance, it's a bacterial agent, coronavirus is a notifiable disease, and exposure to coronavirus at work is a dangerous occurrence. As a biological agent and a hazardous substance when being worked upon, for example in a laboratory, for example, it's a notifiable disease and a dangerous occurrence. And some examples of types of incidents that need reporting are as follows. An unintended incident at work, which leads to someone's possible or actual exposure to coronavirus. This must be reported as a dangerous occurrence. A worker that has been diagnosed as having COVID-19 and there is reasonable evidence that this was caused by an exposure at work, this must be reported as a case of disease. And if a worker should die as a result of occupational exposure to coronavirus, this would clearly be reported as a fatality. I would emphasise that there is no requirement under RIDOR to report incidents of disease or deaths of members of the public, patients, care home, residents or service users, which will include participants in sports. The reporting requirements relating to cases of or deaths from COVID-19 under RIDOR apply only to occupational exposures, that is, as a result of persons at work. Specific legislation imposed as a result of the pandemic doesn't require any specific notifications. Risk assessments. Here we're going to look at the what, why, the who, and the why. What are they? Why are they required? Who they should be undertaken by, and how they should be done. A risk assessment is a systematic general examination of anything in the work environment that could cause injury or ill health. It's not about creating huge amounts of paperwork, but rather about identifying sensible measures to control risks in the workplace. It is likely that there will be already controls in place to protect those who might be harmed, but your risk assessment will help to decide whether what is in place is enough or whether additional controls are required. Why do we have to carry out risk assessments? Well, notwithstanding the moral duties to look after our fellow man, woman and child, there is a legal requirement to undertake risk assessments, implied by the Health and Safety at Work Act 74, and specifically by subordinate legislation such as the Management of Health and Safety at Work regulations, as amended, and more recently in the joint statement by the Scottish Government, Police Scotland, Health and Safety Executive and local authorities on safe workplaces, published 26 May 2020, which said, and I quote, "It's essential that employers also carry out a COVID-19 risk assessment. This has been reiterated in subsequent guidance published." The risk assessment can be undertaken by one person or a group of persons, the importance being whoever undertakes should have experience of the task, area, process, equipment being assessed, and there should be at least one competent person involved, either in the preparation or to review the risk assessment to confirm it's suitable and sufficient. The competent person need not be employed by the organisation, and external competency is permitted. Gallagher have been involved with a number of organisations throughout the UK undertaking reviews of COVID-19 risk assessments, validating them against existing legislation, COVID-19 guidance and protocols. At the time of delivering the presentation, we've undertaken approximately 150, of which approximately 75% failed initially the validation exercise. There are a number of templates available to assist with undertaking a risk assessment. Sports Scotland has published a template which sports national governing bodies can use to record the findings of the risk assessment. Undertaking the risk assessment isn't just about filling the form in, though, far from it. First issued in 1995, the Health and Safety Exec's Information Guidance Document 5 Steps to Risk Assessment became one of the principal guides for undertaking risk assessment. The 5 steps are: identify the hazards, a hazard being something with the potential to cause harm. In this example, we would take COVID-19. We need to decide who might be harmed and how. The how bit is very often overlooked, but it is important. Evaluate the risks. A risk is the likelihood of harm arising and the severity of the resultant illness or injury, and decides on the precautions needed. Generally, you need to do everything that is reasonable and practicable to protect people from harm. This means balancing the level of risk against the measures needed to control the real risk in terms of money, time, or trouble. However, you do not need to take action if it would be grossly disproportionate to the level of risk. Your risk assessment should only include what you could reasonably be expected to know. You're not expected to anticipate unforeseeable risks. Risk will need to be reduced to its lowest practicable level. The findings will need to be recorded. Where there are 5 or more employees, this is where it's useful to have a template. Maintain the risk assessment under periodic review. This will be regular in view of changing guidance as Scotland moves through the phases of Scotland's route map through and out of the crisis. And the risk assessment should also be communicated to those who might be harmed and implemented within the organisation. So let's move on to returning to sport and beyond the guidance. Guidance, general, sector and sports specific, has been issued and is readily available. Sports Scotland has issued guidance to sports national governing bodies, and these in turn are issuing guidance to their members. I don't intend to reiterate the guidance issued, but will provide interpretation and clarification of concerns raised by the guidance, as well as aspects of risk management for you to consider, which will enhance your approach to controlling COVID-19 during the return to sport and assist with mitigation in the event of civil or criminal actions being raised. These are the areas which I will be covering. So taking them from the top. I mentioned responsibilities earlier with regards to duties imposed. If you recall, everybody is responsible, however, some are more responsible than others. But how does this work in the real world? Some clubs have their own facilities, while many use facilities which are owned by local authorities, schools, colleges, or private businesses. Swimming clubs, for example, will use local authority or possibly privately owned swimming pools for training and competition. While the owner or the operator of the pool facility have a responsibility to ensure the safety of users of the facilities, the club also has a responsibility to its members and others who might be using the facilities. Communication here is key, and the need to maintain records is essential. Risk assessments will need to be exchanged, reviewed, and revised as necessary. I, for one, certainly wouldn't want to rely in a court of law upon somebody else's risk assessment. I'd want to make sure that it was suitable and sufficient as far as I possibly could. First aid. Try to assist at a safe distance from the casualty as much as you can and minimize the time you share in the breathing zone. If they are capable, tell them to do things for you, but treating the casualty properly should be your first concern. Remember the 3P model: preserve life, prevent worsening, promote recovery. There is guidance on first aid readily available. The HSE is a good source, but it's important to maintain your own safety if you are a first aider, but also maintain the safety of the person that you are treating. Each sport club is accountable. Their accountable officer should name an existing member of staff as a COVID-19 officer. They will be responsible for overseeing the COVID-19 risk assessments, ensuring the necessary level of risk mitigations are in place and the minimum guidance is achieved, has taken place, and that sports and any partners, hosts, can adhere to their guidance responsibility within local constraints. In addition to that, each sport should also have a named COVID medical officer or physician familiar with the emerging evidence related to post-COVID-19 pathology, who is expected to lead on ensuring any suspected or confirmed COVID-19 cases are managed in line with sports COVID-19 case management protocols and current government guidance. They should have a medical oversight of the return to training of any athletes with suspected or confirmed cases of COVID-19. They should support the COVID officer with any medical aspects of the risk assessment and mitigation process. And sports who do not have a medical officer to cover these responsibilities should secure medical cover to oversee these processes prior to resuming organised training. Regular screening for symptoms within the training environment may be carried out by an appropriately trained healthcare professional, working with a set of protocols defined in the risk assessment, mitigation plan, and signed off by the medical officer. The requirement for safeguarding still remains. Safeguarding of children and vulnerable adults is no less important during COVID-19, and the pandemic presents new safeguarding challenges for all those working or volunteering with children and vulnerable adults. Think of the situation where we have one-to-one training through social distancing. And I needn't explain the problems that might materialize as a result. In line with safeguarding, the COVID COVID-19 risk assessment should also consider persons at higher risk of contracting COVID-19. The guidance published by UK and Scottish governments refer to assessing risks with specific reference to persons at higher risk of contracting COVID-19. Two categories of person have been established: those who are clinically extremely vulnerable and those that are clinically vulnerable. But consideration needs to be given to the safety of all persons in these categories, which will include expectant women, disabled, Black and minority ethnic persons, and those with obesity problems. The employer, coach, or manager cannot and should not expect a person to work or play they do not feel safe. The decision to work or to participate in sport has to be made by the individual. However, support, advice, and guidance will assist those with concerns. Nobody should be forced to return to work or sport. There have been concerns raised about mitigation. The actions taken by sports national governing bodies to protect their employees, members, club management, their employees and members are required to be suitable and sufficient, and the risk controls implemented need to be reasonable and practicable. Following the guidance and preparing a suitable and sufficient risk assessment will go some way to preventing the contraction of COVID-19, mitigating the consequences of legal action should it arise. The contraction of COVID-19 is just another hazard. The fact that the severity of the illness is potentially fatal and the likelihood of contracting the disease without proper controls is extremely high make it no different to a multitude of other hazards to which people are exposed on a daily basis. Granted, COVID-19 is widespread and not confined to any one activity, area, process, or task. However, while there is nothing that can be done to reduce the severity of the disease, implementation of suitable and sufficient controls will reduce the likelihood of someone contracting the disease. Existing risk management practices, assuming of course that they are suitable and sufficient, should continue. The only reason to improve or enhance risk management practices are if they are not currently up to standard. A lot of organisations will have volunteers, and the liability of organisations to volunteers is no different to employees. Section 3(1) of the Health and Safety at Work Act 1974 imposes a duty on employers to conduct his undertaking in such a way as to ensure, so far as is reasonably practicable, that persons not in his employment who may be affected thereby are not thereby exposed to risks to their health and safety. And as earlier mentioned, there is a duty owed to volunteers by the organisations. What if participants don't follow the guidance? The question here is whether you've done enough and what constitutes enough. As long as you have undertaken a suitable and sufficient risk assessment, identifying all the foreseeable hazards, evaluating the risk, and introducing reasonable and practicable controls to reduce the risk as far as is reasonably practicable, as long as you've communicated the significant findings of the risk assessment to those who may be affected, and implemented the controls and maintained the risk assessment under review, then participants not following the guidance ought not have any ground for action. The test will be negligence, as determined in the landmark case of Donoghue versus Stevenson 1932, which established the general principles of the duty of care, that a duty of care was owed, that this duty of care was breached, and that injury, illness, damage, or loss resulted from the breach. Registers of participants in activities is recommended in the guidance emanating from Sport Scotland and is essential for track and trace purposes. Should one or more participants show symptoms of COVID-19, as we've probably seen in the reopening of pubs this weekend in England and from yesterday, I believe, in Scotland, the reopening has demonstrated the need for this caution. Any data held should, of course, be compliant with general data protection regulations. What about self-employed coaches and risk assessment? Self-employed coaches have a duty imposed by Section 3.2 of the Health and Safety at Work Act. This is to conduct their undertaking in such a way as to ensure, so far as is reasonably practicable, that he and other persons not being his employees who may be affected thereby are not thereby exposed to risks to their health and safety. In order to comply with this duty, the self-employed coach will need to assess the risks to which they and the people are coaching are exposed, and to introduce and maintain suitable and sufficient controls to ensure the risks are reduced to their lowest practicable level. There is a requirement for the self-employed to undertake risk assessments, as we've seen in the management regulations. However, only if they have 5 or more employees are they required to record the significant findings in writing. It would not be considered unreasonable, though, for the organisation employing the coach to request written risk assessments to demonstrate that their assessment of the risk and the controls introduced are suitable and sufficient. So moving on, really approaching the summary, the mop-up, that's not a deep clean, and summary. There are 4 topics here. Home working, for example, and risk assessments. For those people who are working at home on a long-term basis, the risks associated with using display screen equipment must be controlled. This includes undertaking home workstation assessments. However, there's no increased risk from DSE, according to the HSE, in respect of work for those working at home temporarily. So in that situation, employees do not need to do home workstation assessments. However, what is temporary? We're 15 weeks into lockdown. Some employees will have been working from home from the start. There could come a time when home workers are no longer considered temporary. It could be that issues with home workers' health and well-being may start to manifest themselves sooner rather than later, and that needs to be avoided at all costs. So what can be done? You could provide workers with guidance on how to correctly set up and use their workstation, and provide advice on completing their own basic assessment at home, as well as tips on how to reduce risks, for example, posture, regular breaks, avoiding awkward static posture and eye fatigue. Support and training. There was a question raised with regards to what can Gallagher Risk Management Solutions provide with regards to support and training. I'm pleased to say we are available to provide support and training on risk management, and current initiatives specific to COVID-19 are a COVID-19 risk assessment validation service. There are 3 levels: the assessment validation, validation plus, or risk assessment assistance. Briefly, the services are: with COVID-19 risk assessment validation, one of our health and safety consultants will undertake an independent professional review of the COVID-19 risk assessment as presented, comparing it against existing legislation, COVID-19 guidance and protocols. Where the document is considered to be validated, we will inform. Where it isn't, we will provide a brief, high-level summary of the areas requiring improvement. This should ordinarily be enough for the competent person in the organisation to address those issues and produce a risk assessment which meets the recommended requirements. Where this isn't the case, we can provide Validation Plus service, which will provide the further assistance should it be required. And in this instance, a safety consultant will provide specific detail of the areas requiring further consideration, offering suggestions to assist with the document's further development and subsequent validation. Some organisations, however, may not have undertaken a risk assessment at all. In these instances, Gallagher Risk Management Solutions will provide the organisation with the tools and mentoring to allow them to prepare a suitable and sufficient COVID-19 risk assessment. Further services which may be of interest include business continuity planning, testing of those plans, risk registers, business impact analysis, And we also have a Gallagher online risk management portal and e-learning modules, which have been updated to include elements relative to the COVID-19 pandemic. How long do risk assessments need to be retained? Well, essentially, they need to be retained in accordance with the periods detailed in the Prescription and Limitation Scotland Act 1973. For civil claims, this is generally 3 years from becoming aware that an injury has been suffered. However, there are qualifications to this and amendments, which mean that particularly in respect of minors, it is from the age of 16 and generally will be from 3 years thereafter where actions will need to be taken. And finally, on this section, what is meant by deep clean? That's an interesting question. Until I looked up, I didn't know the answer, but essentially a deep clean is defined as an exceptionally intense cleaning process. But what does this mean? UK government guidance refers to cleaning and disinfection. A deep clean pre-COVID would include areas not necessarily with which people would have contact, behind equipment, cookers and fridges in a kitchen, for example. However, the infection risk from coronavirus COVID-19 following contamination of the environment decreases over time. It's not yet clear at what point there is no risk. However, studies of other viruses in the same family suggest that, in most circumstances, the risk is likely to be reduced significantly after 72 hours. My advice is to follow the guidance and clean those areas where it is reasonable to believe people may come into contact. So thank you for listening to the presentation. I'd now like to take your questions.
Thanks, Brian. So we've got a couple of questions there on the chat. I don't know if you had time to pick up on those. But,
well, first of all, the COVID and medical professional, I think that's the COVID officers, is it? Yep. I've just looked on the guidance, and I think I got a little bit confused yesterday, but I don't know if that's correct or not. There is certainly a requirement in elite and performance sports to have COVID officers and COVID medical officers. I'd seen that yesterday or the day before. I'd also seen some of the guidance that had been published by the sport national governing bodies, which also referred to it. It's quite likely that those that I looked at were the elite or performance sports that the sports national governing bodies had. I suspect if you haven't already got a medical officer, then there's probably no requirement for you to have a COVID-19 medical officer. So it's probably only in relation to the elite and the performance sports, but I can check on that and confirm.
I think that'd be very helpful because it comes through in the presentation, certainly at this stage, as a requirement. So we may need to make some adjustments before we send out a final pack if we think that's the case, Brian.
Okay. Yep. And the other one was understanding the scenario in respect of direct and identifiable employees. But does the occupational aspect of occupational exposure apply in respect to volunteer coaches, managers, etc.? Quite simply, yes. There is this duty of care that a volunteer coach will have to other people. So whilst they're not treated and don't have duties imposed by health and safety law, there is the civil law, and it is likely that any action that's taken against them will be a civil action, in which case they need to comply with the law. I'm not sure whether that answers the question.
You understand the expectation, but obviously occupational exposure on this occasion, forgive me, my wife's on another call, is related to the radar expectations. So I'm not entirely sure, working with volunteers over whom we don't have direct sight, if they sustain COVID-19, if they're exposed or heaven forbid they die, how that comes back to us to be able to identify and report it under RIDDOR regulations, given they're volunteers out with our direct control. So how can we do that?
Whilst they're a volunteer, are they at work? And the answer to that is yes, they are. So whilst they're not an employee, you are responsible for them as another person. So yes, it would have to be reported to RIDDOR.
Okay, so that's obviously a particular interpretation of being at work, given their full-time job's something else.
Well, yes, I mean, they are actively engaged at work. It doesn't necessarily, you know, people can have a multitude of jobs. My interpretation is that it would be reportable.
Okay.
Just scrolling down.
I know you're going to come back to it, Brian, but Lloyd's picked up another point there in definition. Lloyd, do you want to pick that up briefly? It might be that Brian can come back in context, but I think you've raised an important nuance there.
Yeah, my understanding for professional athletes are classes almost like full-time paid athletes that rely on playing the sport to have their income, and I think that's what Sport Scotland and the government are defining as returning back to play. I wasn't sure if that affects in terms of the medical officer requirement for the sport.
I probably could get back to you on that if that's all right, Lloyd.
Yeah, certainly.
Yeah,
it's quite a particular nuance, Brian, but I think it's a useful one.
Yes. Yeah.
I think other. Sorry.
Go ahead, Kim. Sorry, you're picking up the questions. Go ahead. Sorry.
No, I was just going to say, so Fiona, I'll maybe come to you in a second in terms of if that answers the question. I know you'd had a huge number of the members of Horse Scotland are self-employed coaches, so just I'll pick up with you in a second there on that one, Fiona, if that's okay. Brian, one of the conversations you and I had in advance of this was because one of the particular points that you've raised, I think, was about people that have been identified at higher risk.
Yep.
So one of the areas of work that governing bodies have been working through for many years is trying to better understand the equality profile of members.
Yeah.
And then clubs have been trying to do that quite often with their members. So knowing that two of the characteristics that you've mentioned are age and ethnicity, where science has proven that people are at added risk of that, does that bring any kind of additional liability or any additional mitigation measures that governing bodies and or their clubs should be putting into place in that regard, or is that just further reinforcement of why it's so important that our members do understand the characteristics of their members and clubs understand the characteristics of their members?
I think it's your second point that is more valid there. It was something I was certainly giving a lot of consideration to in preparation for the presentation. Essentially, you really have to make sure that all persons, and it's the same with any risk assessment, it's one of the questions, who is at risk? And there's going to be some more at risk than others because of their particular characteristics, because of their age, because of their ethnicity, because of their youth, their vulnerability, their expectant mothers. So you have to consider all aspects of people. I think it's useful to know the different characteristics, but from a politically correct and not wishing to sort of, what's the word I'm looking for? Even though you've got the best intentions, I think to publicize anything would be seen in the wrong light by some people. So I think it's more important to make sure that all people are catered for when you're undertaking the risk assessment. And that's one of the reasons why, and somebody asked a question with regards to, we've got a standard risk assessment that the Sports National Governing Body has developed. Can this just be accepted by clubs? Well, if it's relevant to everything that the club does and it takes into account all of the people that might be undertaking the activities, but then yes, but the likelihood is that probably not. So it would need to be adapted Might not need a lot of adaptation, but it would need to be adapted to be club or organisation specific.
Thanks, Brian. That's really helpful. And so just picking up again in the chat box there, so it's a really interesting point that Alison's raised about risk assessments being issued by a charity for women who are pregnant. Would we anticipate that these would be specific sets of risk assessments that would be expected to be undertaken by a club, Brian, around each different potential category of additional risk?
No, the employers are required to undertake new and expectant mother risk assessments as a legal requirement. I don't suggest that the persons who have or are clinically vulnerable or are otherwise vulnerable to COVID-19, we undertake a specific risk assessment for them. And particularly with regards to Black and minority ethnic persons, really there's enough, if you follow the guidance, there should be enough information within the guidance for you to take account of those people in the risk assessment without having to undertake another risk assessment. So I would say the considerations perhaps that are in the new and expectant mother risk assessments can be followed. There could be reference in the individual risk assessments that are undertaken for those people with regards to COVID-19, certainly, but I wouldn't put that in the COVID-19 risk assessment.
Okay, good stuff. Thank you very much. That makes sense. Lloyd, so you've just popped up a question there. Do you want to pick that one up, Lloyd?
Yes, I understand that you don't have to report under RIDDOR for players who are not employees or volunteers playing the sport. But my thinking is then if you are playing with officials and players on the pitch where then the officials are volunteers, we need to always then protect them under regulations and under RIDDOR. If they had symptoms, you have to report that. So therefore, as part of the risk assessment, should players then who then become symptomatic also then report this to the governing bodies, so then we can then almost protect the volunteers to advise them that someone within their proximity has had symptoms?
Well, yes, and all participants, there ought to be a register. Certainly, currently, a register of participants so that you can contact them to track and trace.
Okay.
So that would be participants, volunteers, as well as employees who you already have or should have contact details for anyway.
Alison, I wonder if you can help. One of the key considerations that we would often get asked across Scottish sport would be around volunteering, so something that's obviously the lifeblood of Scottish sport, but that is perhaps a very specific aspect of volunteering. So if volunteers aren't recognised as being separate to employees when you think about insurance, are there still then specific considerations governing bodies and sports clubs should be giving to volunteers when they consider their insurance requirements?
It is interesting to note that normally the best way of handling this is to make sure volunteers are specified under the employer's liability as being insured as an employee, as well as, of course, being covered under the public liability. And the reason for that is because there have been cases where it's gone to tribunal rather than through the courts, but so far volunteers are 99% of the time considered covered under the public liability, but there's 1% of the time where they do the same role in a continuous fashion, week after week, hours after hours, where there was one case in English law where that person was considered an employee, and as an employee you have more rights under the Employers' Liability Insurance Act.
Does anybody else have any questions that they want to pick up?
Bryan, I think when we spoke, sorry, anyway, when we were having the discussions about what was going into the presentation, we mentioned, screening, questions that the clubs and the sports may want to think about, in terms of asking, people who are going to be participating in the sport, whether or not they've had COVID-19, whether they've been in contact with anybody, as a mechanism for defensibility and, in any future, claims or anything that goes in. Could you maybe expand on that a little bit for the guys?
Yeah, sure. In a sense, anything like that shows and is good mitigation. And I suppose as part of the invitation to a reminder to participants, wouldn't go amiss to say, if you do have any symptoms or have recently had symptoms or are known to have COVID-19, then you really shouldn't be participating in this. So it's probably down to very, very good management, certainly. A record of that would certainly go down well. I've known an instance where somebody it's a school situation, it's not a sports situation, but somebody sent their child to school knowing that they had symptoms of COVID-19, subsequently were tested and proven to have COVID-19. That could have been avoided by the parent not sending the child to school. Now, sport obviously does relate to children as well as adults, and I would expect a similar thing to be taken into account, that parents do not send their children should they be symptomatic or have the disease. But I also know what happens when, with sports and sports associations and clubs, it does become for children a babysitting situation on occasion. So I am aware of what parents and how they might use the facilities and the sports clubs, but certainly, Andy, that anything like that, screening of participants will be a good mitigating factor.
Thanks very much, Andy. I think that's a great point and really helpful, Bryan. And I'm going to come to Callum's raised a really pertinent question there. And I think your answer earlier, Bryan, I think really reinforces why it's important for us all to know our members. So for governing bodies to know their club members and for the club members to know their own individual members to be able to provide that protection, which obviously extends to elite athletes, picking up the earlier conversation as well. And I think, as you say, it's an additional ask of, governing bodies won't hold information about their individual members who may or may not have had COVID, obviously. But obviously, if a vaccination comes, then again, there's an additional level of questioning. So, Callum, I think that fits into what you were saying as well around the requirements around how we confidentially store data and what that looks like. Do you want to pick up there, Callum?
Yeah, I suppose it was just a variation of what Bryan was cautioning us against by way of doing risk assessments that specifically identified a sector of our membership. I'd be a wee bit wary of approaching our members at an event and asking them to disclose what's essentially medical information. Mm-hmm. My systems aren't accredited to that level, to hold that level of security. And likewise, in terms of disclosure, whilst it might salute the litigation, I'll find myself in breach of the Information Commissioners, and that's a criminal offence. Yep. So in an attempt to mitigate one risk, I inherit the other. So I suppose my proposition would be to educate our membership and to take advantage of the wider messaging and to know our membership. I actually think in an attempt to mitigate, we can have general declarations as mitigation, but specific questions might create more of an issue for a lot.
I agree almost totally with you, Callum. My reservation is, and particularly not with regards to data protection regulations, but certainly in relation to the relationship between health and safety law and employment law. If there was any dispute between the two, health and safety law trumps employment law. So, and there have been instances where a judge has gone against an employer who has not relieved somebody of their employment because it was unsafe for them to continue work. And the judge said, well, really, you should have terminated their employment because they could no longer work safely. A bit harsh, but that brought about the scenario that health and safety law does in fact trump employment law. Now, with regards to GDPR, and one of the reasons why I said put the onus on the individual to let you know, or to bear in mind the fact that if you've got COVID-19, you shouldn't. As long as you've done all that you could possibly do in a legal way, so by guidance, by education, by steering them down a particular route, then that is mitigation enough. And I don't suggest for 1 minute that you hold all sorts of medical records, even if they're quite open to tell you. You don't really want to know that sort of information. And similarly with, you know, ethnicity, there should be no reason why we ask the question, which you see on many questionnaires. You know, are you white or are you from one of these ethnic minorities? That shouldn't enter into it. So I go along with what you're saying, Callum, almost and probably 100%.
100% in risk assessment, Bryan. That's quite risky.
Sticking my neck out, isn't it?
No, I think that's music to people's ears, because I think, as you say, it's very challenging knowing the balance of that. And certainly most equalities information that's gathered by governing bodies is around equality of opportunity, to try and make sure that things are available to everybody and open to everybody. Carol, does that answer the question that you've popped in the chat box about the balance of screening versus requirement?
Yeah, it does. Thank you.
Perfect. Good stuff. Anybody else? Does anybody else have anything they want to raise?
Just going along the lines there, if someone turns up displaying the symptoms of COVID, how do you deal with that? Are you entitled to send somebody home because they may be endangering people?
Most certainly. Most certainly. Difficult conversation to have, possibly. Yeah. There might be resistance from the participant, or if it's a minor, their parents or guardians. But the same within, we see in supermarkets, you know, if people encroach 2 meters, there are glaring eyes, not quite physical violence, but it's that sort of thing. And you're quite right. You should turn somebody away who is experiencing them. If they went into, you know, any establishment, if they tried to board a public transport, they would be turned away. So you're quite within your rights to do that, yes.
And I suppose, Bryan, the ultimate check that airports everywhere else has sort of been using is really the temperature check position as a kind of clear set of evidence, but appreciate that there are other symptoms, but everybody's been using the temperature check mechanism as a real sort of opportunity to,
and whilst
either one side or the other.
Yeah, whilst that might be incorrect, yes, somebody might have a temperature, but not necessarily have COVID-19. I'd rather turn away somebody that's got a temperature rather than not and suffer the consequences.
It's a funny point. I was on a call with a client yesterday, and they'd got a temperature as a hotelier, and they've got a temperature system in place, and the guests were very pleased to see it. But believe it or not, some of the thermometers, I don't know where they got them from, but they were kind of showing wrong temperatures like you'd be dead to have them.
Right.
So that's another thing, isn't it? You've
got the risk of the calibration of the devices. Yeah. Absolutely.
Yeah.
I wouldn't put a hand to somebody's forehead, put it that way.
Always a good tip. Always a good tip. No, it's a very fair point, and certainly I know that was a conversation, Lloyd, we had a couple of weeks ago where you were asking exactly that question around, you know, expectations of, you know, whether that's training groups or when elite players and things start to train together from a team sport point of view, or when mass gatherings are allowed and we've large scale events back together, what are the expectations of, you know, doing that kind of, what I suppose deliberately is screening, like Carol was saying, as people come in, of temperature checks and things.
Yeah, absolutely. And the way to have, you know, these monitors at sporting facilities to test participants and spectators when they're allowed back into venues.
It's a good thing that we all need to spend extra money on new equipment just when everyone's cash flow is looking sensational.
It's a good point. It's a good point. I'm going to come to you in just a second, Kirsty, just in terms of if there's anything that you want to pick up. I know one of the big conversations has been around, or I guess always in insurance, it's the conversation that Liz has so often with ourselves and with Andy and Alison around grey areas. Never an insurance favourite phrase, I'm sure. And I know some of the questions that came from governing bodies was very much about facilities, you know, if a club is operated out of a different facility, and that obviously being Kirsty's members in terms of the trust. So Kirsty, was there anything you wanted to pick up? I know this is an area that a lot of your members will be working through in great detail as well.
Thanks, Kim. No, I don't think there was anything specific. I think a lot of what's been discussed here sort of resonates with discussions that are happening across our members. I'm not sure we have any more of the answers than anybody else does, which is probably not so helpful. So, I mean, we know, for example, that the phase 3 guidance refers to risk assessments and dynamic risk assessments, and kind of encouraging organisations, certainly our members, to publish those risk assessments. So they would be obliged to publish any risk assessments from a leisure trust perspective. I think that's kind of about building confidence, which will hopefully be a positive thing. We're also kind of involved in the impacts and modelling group with Scottish Government, kind of looking at the risk assessments that are going in there for reopening facilities, and trying to kind of look at those from an operator's perspective. I think one of the kind of key questions that keeps coming up is around kind of club access and kind of sport access to facilities, and where does kind of who's responsible if it's a club coming to use, whether it's a football pitch or whether it's an indoor facility. Is it the kind of operator, as in the leisure trust, or is it the governing body, or is it the club, in terms of sort of checking who's actually coming, both from whether somebody might be displaying symptoms, but also from enforcing social distancing, whatever that may look like. So I don't think there's an answer on that, but there's certainly ongoing conversations around a need to join up. So I think as we progress further towards reopening, and I know we're expecting the reopening of indoor facilities later this month, so it'll be kind of imminent that those conversations will start to come through a bit more. So perhaps just worth keeping sort of touching base on that. So that was a very long-winded way of saying, in short, no, I don't have anything particularly useful to add.
No worries, thanks, Kirsty. I know there's a question from Lorna, so I'll come to that in just a second, Lorna. Brian, do you have any reflections on what Kirsty was saying? I know you covered some of that early doors about that very difficult area of when clubs operate out of a facility run by somebody else.
Yes, I think on the day or at the time of the activity, then it's the club. But prior to that, it's a combination of the club and the facility owner or provider. And as I said, communication is key. You need to not rely upon somebody else's risk assessment, but look at it, review it, annotate it, send it back if you're not clear of anything. If you're familiar with the premises, then fine. If you're not, if you can visit the premises prior to the activity, all well and good. Just to make sure that, you know, it's not, I mean, an example could be a local authority provides a football pitch or a hockey pitch for use. They've done a risk assessment the day before. The ground is clear of all glass and anything else. I wouldn't rely on that. I would do my own inspection and make sure that that's the case. So it is a combination of the two that's absolutely necessary to make sure that it is safe.
Thanks, Brian. That's really helpful, a very pertinent example. I know, Jennifer, a couple of your colleagues raised exactly that kind of question quite recently in terms of how does that all fit, knowing how often that's as you say, a sort of shared responsibility. And Lorna, you've got a question there around, as you say, what how you support screening and gathering of information. Has that answered your question on that, Lorna, or do you have anything else you want to pick up there?
Well, it's really the NGBs will do all the risk assessment, the clubs won't. Let's face it, we've got small clubs. So if something happens and the clubs haven't done that risk assessment, where does that leave us? We cannot physically travel to the borders, to Aberdeen, to Dundee, to St Andrews. We can't physically go and do risk assessment and the check like you just suggested. It's physically impossible. So where does that leave the NGB?
I think if the NGB has got as thorough risk assessment as possible and it applies, then that could be all that's necessary. I don't know, what area are you in, Lorna? What is it that?
It's lacrosse.
Lacrosse.
So it's a team sport. Outdoor. Well, it's outdoor and indoor, predominantly outdoor.
Outdoor, okay. But
we don't have our own facilities, we don't have our own venues. We use local authorities or universities or school venues.
Right. But in that instance, there'll be a coach, presumably, or a manager responsible for the team?
Yeah.
So I would say that, from an inspection of facilities perspective, that's what they would do. Checklists are very, very good for consistency. So, I mean, those are the areas, and I'm sure that I've seen an abundance of checklists from Sport Scotland. So resources will be available, definitely, for that sort of thing.
Yeah, it's like you can take the horse to water, but you can't make him drink. So, yes. We've got all we could have the best checklist and the best risk assessment, but if it's not followed through, then it's kind of not worth the paper it's written on. So it's from that point of view, so something that does go pear-shaped.
Yep. As long as you can demonstrate that you have communicated this, you have reiterated this, you've communicated again, there will come a point where you need to take more action, but as long as you can demonstrate that, you have tried to communicate what they should be doing, you've possibly communicated that you're not doing this, then that would be grounds certainly to be considered in mitigation.
Right, that's good. Like, we're running webinars and we're publishing all the information on the website and all this kind of stuff. So we're doing as much as we think we can. But if there was any more that we needed to do, it'd be good to know.
I don't think there is, and it's something that you may request risk assessments from a local authority. You may never receive them. You probably get them from a local authority. You may not get them from a private provider of facilities. But that doesn't mean to say that you ask once, don't get, and forget. You ask once, you try again, and then if you don't get, you seriously consider whether you
want to use that facility.
Well, yes, that's right. Either risk assess it yourselves, or if that's possible. If it's not possible, do you use those facilities? I would rather, unfortunately, have something cancelled because it's unsafe rather than have something proceed knowing it's unsafe. It's a recipe for disaster.
Yeah, no, we've said the members that we're erring on the side of caution, etc., because the last thing we want is a single case associated with our lacrosse, our sport. So the members are very clear about our risk averseness in this instance.
Yeah, good.
I think that's very fair, and I think, Laura, that will very much echo Kirsty's members and what that looks like, as Kirsty was saying, and as so many of the conversations Kirsty and I end up having is around that managing expectation and how best people can be as transparent as they can be. So it's in everyone's interests that we can all get back at whatever point that is safely. So I know we'll all be working on that very hard together. I think Lorna's question does lead to one, maybe Bryan, and it's perhaps partly risk and the analysis, partly insurance as well. One of the questions that's come up quite often in conversation with members is saying they're working incredibly hard, and our members have worked incredibly hard throughout this whole period to try and provide accurate and up-to-date and very timely, which is always a challenge in its own right, getting all three of those bits together, guidance out to their member clubs and their member individuals on what's happening and what to do and how to follow guidelines specifically for their sport. But equally, we've had some governing bodies whose sports haven't been able to be participated in as yet for the range of the specific nature of that sport. However, they've said they've had some clubs saying, well, we're just doing it anyway. We're just going to go and do that anyway. And a lot of that conversation has then revolved around risk assessments and insurance, and saying, well, if the governing body has provided guidelines to say, at the moment, the guidance from government means, from our sports-specific point of view, here is the guidance. If that's not then being adhered to by a club or a group of individuals, I assume the liability for that then sits with that individual club or those sets of individuals themselves, rather than with the governing body and their risk and their own insurance. Is that correct as an assumption?
From a risk assessment perspective, I would say, sorry, from a risk management perspective, I would say yes. You know, I suppose in a sense, it's like the risk assessment. Have you done all that is reasonably practicable to ensure the safety of that activity? Has the national governing body done all that is reasonably practicable to communicate the policies and the procedures that they've developed and drawn up with the clubs? That should be sufficient from a risk management and health and safety perspective. And the responsibility will fall on the club or the individual member or whoever.
And therefore, if that club is going against the governing body guidelines, which are in line with the government guidelines, then I guess the question would be the cover provided by their insurance potentially.
Yeah, I think if they're going against the guidance, it's a very difficult area, because on liability insurance, which is what we'd be talking about here, there needs to be a legal liability. Yes, and there would be a legal liability if you're doing something against the law, in inverted commas. But the downside is insurers would expect you to act prudently. And if you're going against, you know, fairly straightforward advice from the government, then I think, yeah, they might look to repudiate it or have some sort of contribution in required from the club. I don't think it's automatic that they'll pay. They may well have to if it involves an employee becoming poorly, because there's more legislation around looking after employees than looking after people who are not considered employees. From the insurance perspective. But I mean, in England at the moment, I'm not clear on who can do what, quite frankly. You've got it much clearer, I think. So I think any insurer would have to bear in mind if there were kind of interpretations of guidance. So.
There has been an incident in England with the English Cricket Board. The government said cricket cannot resume. And I think it might have been Boris himself who said, well, what about changing rooms and teas? And the ECB pointed out, well, we don't need to use changing rooms. The players can change elsewhere. They can play, they can go back to where they came from without having to use facilities. They can bring their own packed lunch as tea. They don't need to have tea. So they actually, okay, that was a comment by the government, not guidance. But there's always, guidance is guidance. It's not enshrined in the law. The need for risk assessment is, but the guidance can be challenged. But there is a but, there's always a proviso. I think generally the guidance is pretty good. Certainly the guidance I've seen in Scotland from Sport Scotland, from the sports national governing bodies has been very, very good. It's there to guide, essentially. It can be challenged, but probably that, is it worth challenging? It might be if in practical terms, the guidance cannot be followed. But that's on a case-by-case basis.
Thanks, Brian. And if a club had an issue with that, then I'm sure the first thing they would do is pick up that call with the governing body to understand the interpretation of that. So that makes sense.
Yeah.
I'm very conscious of time. on the assumption that there are no further questions, I don't think there's anything. I think we've managed to get through everything. Somehow in the chat box, Bryan, you've done a phenomenal job in managing to pick up all of that. It must feel like sort of 20 questions or Mastermind or something. But certainly if you do go on Mastermind, Bryan, I recommend that your topic is risk, because quite clearly you know more about it than anybody I've ever met, which is
thank you very much.
Fabulous. Well, it's exactly why it's been so great to have you in the call today. Liz, do you just want to pick up some next steps before we maybe do a last round of thank yous to people, and then obviously Andy or Alison, if you guys have got anything you want to pick up thereafter. Is that all right?
Yes, certainly. So as we said at the head of the call, we will put this out on a collective recording. We'll also issue the slide pack separately. And Bryan, you and I can pick up if there are any nuances in there which need to just alter in a minor way. We will, I'm very excited to say we continue to work with Gallagher on developing our propositions around a collaborative insurance approach, which I hope very much that we'll be in a position to be making contact with the Scottish governing bodies in the next number of weeks. Really excited about that. I think it's going to be a great opportunity to bring together opportunity to explore economies of scale, and definitely kind of covering some of the ground that we've already spoken about earlier on the call, about how all of this environment with regard to risk assessment management, etc., leads into creating opportunity for getting the very best value from insurance going forward. So we hope to engage with you on that shortly, and I look forward to making contact with some of you in that regard once that goes out. I think that's all, Kim, in terms of what we need to do today. And Kevin, my thanks to Bryan, Andy, Alison for their inputs, and my thanks to everybody for joining the call and making it extremely valuable, not just in terms of the presentation, but the interaction and some of the questions which we're all assessing and getting involved in. And it's the collective approach which I think in this environment helps us all. So thank you so much for making it very worthwhile.
Brilliant. Thanks, Liz. Andy or Alison, do you have anything you want to throw in, or from the last point of view?
Yeah, just a quick point, Kim. First of all, I'd like to thank everybody for taking part today and for all the questions. I'd like to thank Bryan for putting together the presentation. It was really thought-provoking. And just my last point is that if anybody feels that they need a little bit more support in developing their risk management processes and or the risk assessments, Bryan did mention that we do have some services available there that we can that we can provide for you. But thanks again for taking part, and I hope to speak to you all soon. Cheers.
Brilliant. Thanks very much, Andy. Last thank you from me again to Bryan for what is a power of work and for sharing so willingly all your expertise, and for Liz, because I know there's been a huge amount of work gone into pulling this together today as well. So thanks all very much, everybody. Lovely to see you all, and we'll get this shared with you shortly, and we'll hopefully see you all soon. Thanks, folks. Take care. Bye.
Bye-bye.